AAPI is a forum to facilitate and enable Indian American physicians to excel in patient care, teaching and research, and to pursue their aspirations in professional and community affairs. AAPI USA has been engaged in harnessing the power of Indian diaspora from all over the world to bring the most innovative, efficient, cost-effective healthcare solutions to India. Since 2007, with the launch of the first Indo-US Healthcare Summit in Delhi, under the leadership of Dr. Hemant Patel, the former President AAPI, and Mr. Anwar Feroz Siddiqui, the Honorary Advisor. Since then, AAPI has made significant progress, and under the leadership of Dr. Jayesh Shah, President AAPI, has seen major transformation into a global healthcare summit, which was held from 2nd January to 5th January 2014 at Ahmedabad Management Association. AAPI would like to make a positive, meaningful impact on healthcare in India. The mission of AAPI is to share best practice and experience from leading experts in the world and develop actionable plans for launching demonstration projects that enable access to affordable and quality healthcare for all people. To accomplish this mission, AAPI is backed by leading healthcare experts and professional associations, including Ministry of Overseas Indian Affairs and Indian Development Foundation, and Ministry of Health and Family Welfare. AAPI has organized 7 Indo-US Global Healthcare Summits and developed strategic alliances with various organizations. It is these learnings and relationships that have now enabled them to plan ahead and prepare for outstanding events that has already received confirmation and endorsement from over 300 very prominent and talented physicians and surgeons that are very passionate about serving their homeland, Mother India. In addition, several international healthcare industry partners are looking for opportunities to participate in these events for greater collaboration on research and development and philanthropic engagement.
Well, I practice cardiovascular medicine in the United States, but I see that India is under an alarming threat of a twin epidemic, diabetes and heart disease. And that really touched my heart, and for the last 25 years, I'm coming here on my own, trying to find out, connect with the people to fight this growing menace of cardiovascular disease. There's a myth out there that cardiovascular disease is more common in Western countries, but actually is much more common in middle and lower income countries like India. And because of the poor resources, poor infrastructure, poor access, and poor affordability, people are dying in millions right and left. And there's a growing awareness lately now, but for 20 years nothing was happening. Now I'm very glad to be part of it, and I'm working on NGO and on government organizations to raise the awareness, to write the guidelines, to work myself as a volunteer, and to work with the AAPI and AGAPIO and some other organizations to fight this menace.
Dr. Sharma, being a cardiologist, what kind of an advice you have for a common person living in India to take care of their health so they have a healthy, long life regarding to their heart?
The cardiovascular disease is rampant all over the world, but the best intervention is prevention. And for an Indian or South Asian who is at a high risk for cardiovascular disease, the best thing is changing a lifestyle. And 4 or 5 things are basic. Exercise every day, watch your diet, and lose weight, and then meditate, because there's so much stress. These 4 or 5 things, and then go for a checkup. And if you are at a high risk, please take aspirin, statin, whatever needs to be done, and check out for a diabetes, which hits early young people very early. These 4 or 5 things will go a long way in reducing the burden of heart disease by 60 to 70%.